Hello and welcome to a brand new episode of COVID 360. I'm Sneha Moldani. On the show today, we tell you all about Omicron, the fifth variant of concern that continues to spread across countries. As we speak, close to 100 countries have reported cases of the Omicron variant. On the show, we tell you about the Indian government's projections. The government says expect up to 14 lakh cases a day. But before that, amid opposition uproar in Rajya Sabha, the Health Minister Mansukh Mandaviya has briefed the House on Omicron preparedness. He said the government has learned from the first and second wave and is ready for any future COVID surge. In a big announcement, the Health Minister also said that a vaccine for children will get an approval soon. Mandaviya added that the government is monitoring the situation vis-a-vis the fifth variant and is also studying the impact of vaccines on the new super mutant. He's also hit out at the opposition for politics over COVID, saying people's lives were not a matter to politicize.
आने वाले दिनों में देश में कोविड क्राइसिस बढ़े और केस बढ़े तो उसके लिए भी प्रिपेयरनेस हमने पहले से करके रखी है। उसकी तैयारी के भाग स्वरूप हमने सारी व्यवस्था देश में कैसे की जाए और इसलिए हमने कोविड पैकेज 2 डिक्लेयर किया। 23,000 करोड़ रुपीस का पैकेज 2 के माध्यम से ये पैसे सभी स्टेट गवर्नमेंट को दिया है और स्टेट गवर्नमेंट उसको क्या करेंगे? स्टेट गवर्नमेंट ये पैसे के माध्यम से अपने डिस्ट्रिक्ट हॉस्पिटल में बेड बनाएंगे। शायद बच्चों में इफेक्ट हो तो बच्चों के लिए भी सेपरेट बेड बनाया जाए, उसके लिए आईसीयू केयर यूनिट बनाया जाए, बच्चों के लिए और डिस्ट्रिक्ट प्लेस पर वेंटिलेटर की व्यवस्था की जाए और उसमें से हर डिस्ट्रिक्ट में 1 करोड़ रुपया का बफर स्टॉक किया जाए। उसमें सारी व्यवस्था डिस्ट्रिक्ट और ब्लॉक लेवल पर तैयार हो जाए, जैसे कि भविष्य में केस बढ़े तो भी हमें चिंता ना रहे, तो भी हम उसका मैनेजमेंट कर सके। कोविड केस रिपोर्ट करने के लिए और ज़्यादा टेस्टिंग करने के लिए, जीनोम सीक्वेंसेस बढ़ाने के लिए 38 लैब आज काम कर रही है। पर मंथ 30,000 जीनोम सीक्वेंसेस की कैपेसिटी आज देश ने हासिल कर ली है। दुनिया जैसे जीनोम सीक्वेंसेस करती है, ऐसा ही हम टाइमली जीनोम सीक्वेंसेस कर रहे हैं।
Well, here's a report on what the government is asking people to do to keep the infection at bay and how they are preparing for an upsurge.
As cases of Omicron steadily climb in India, states have been upping their guard, fearing a possible third wave. Maharashtra, leading in number of Omicron cases, has tightened restrictions on mass gatherings.
मुंबई पुलिस ने ये सख्त हिदायत दी है मुंबई वासियों को कि हर कीमत पर कोविड अप्रोप्रिएट बिहेवियर का पालन करना है। अब धारा 144 लगाई गई है। इसका सीधा मतलब ये है कि क्रिसमस सेलिब्रेशंस पर और न्यू ईयर सेलिब्रेशंस पर मुंबई पुलिस की खासी पैनी नजर रहेगी।
Delhi, with fresh spike of Omicron, is also on vigil.
After Maharashtra, it is Delhi which is witnessing highest number of Omicron cases so far. It is also a matter of concern because according to the health experts, the COVID-19's Omicron variant has much higher transmission rate compared to the other variants.
While in Karnataka, screening of international passengers, especially those from high-risk nations, has been tightened.
Now, with the Omicron variant of COVID-19 a clear and present danger, authorities at the Kempegowda International Airport are making sure that two things happen very quickly. All international passengers have to undergo an RT-PCR test, and while they do that, the entire process is hassle-free.
Kerala, still struggling with a steady stream of COVID cases, now faces the double whammy of biggest Omicron threat. It has rushed to increase genome sequencing capacity.
The first case of Omicron confirmation has now brought more attention to the new variant, its detection and the process involved. So the test to confirm if the positive samples is Omicron variant, it takes up to 72 hours and in some cases it takes 48 hours only.
So the moment we receive the sample, we start processing it without any delay because this is currently a national emergency. So we don't really wait for the samples to pile up or accumulate.
With several states now reporting Omicron infections, focus is on inadequate contact tracing of international travellers.
अभी तक अधिकतर केस देश में जो आए हैं या तो ट्रैवल हिस्ट्री है या ट्रैवल से कांटेक्ट की हिस्ट्री है.
The Health Ministry is advising people to avoid non-essential travel, keep clear of mass gatherings and observe extreme caution in festivities. But large gatherings this holiday season are making the task much more difficult.
Even as Omicron variant is not the primary driver of the coronavirus pandemic in India, certainly what's been happening outside the country should be an alarm for Indians. India certainly cannot afford to lower its guard at the moment. With Pankaj Amit and Nolan Erickson, this is Milan Sharma for India Today.
Here's the very latest when it comes to the total number of cases being reported from India today. Let's take a look. More than 160 cases. It now stands at 161. These are the cases. Maximum in Maharashtra at 48. Rajasthan has 17 cases. Delhi stands at 22. Karnataka has 14 cases. Telangana has 20. Kerala has 11 cases. Gujarat and 9. West Bengal 1. Tamil Nadu 2. 1. Andhra Pradesh as well as Chandigarh have 1 case each, with the government now indicating, at least to our sources, that most of these cases continue to have just mild infection. Well, our next report tells you why Omicron is spreading faster and why the infection still appears to be mild. Take a look. Since it was first labelled as a variant of concern, Omicron has now taken over 94 countries.
There are some early studies from the UK that have looked at household secondary transmission, looking at higher secondary transmission as compared to Delta. But again, it's still early.
Scientists world over are trying to put their head together on why this variant spreads faster but does not increase in severity. Not as of now, at least.
The Omicron variant is a change in its genetic sequence that has changed the shape and changed the ability of that spike protein to attach to human cells and enter the human cell, and that's probably what's giving it its transmission advantage.
Well, a study suggests that it is up to 70 times more transmissible than the Delta variant. It actually multiplies faster in the human bronchi, which are large airways that leads to lungs, hence is easily transmissible, and does not actually replicate that effectively or that well in the lung tissue, hence does not cause much severity.
The fact about the transmission or transmissibility of Omicron, it is now kind of documented that the transmission is much faster. Replication or multiplication of the virus is 70 times much faster.
Experts, however, say by infecting more people, a very infectious virus may cause severe disease.
There is some evidence to say that Omicron variant escapes immunity from vaccination and from past infection. There is a significant threat from Omicron variant if adequate preventive measures are not in place.
The centre is taking all steps to ensure that the new strain is contained, since the fear of overburdening our healthcare system remains a big concern. In New Delhi, Sneha Mordani for India Today. Now, as year-end festivities approach, many countries are making vaccine passports mandatory to enter public places like restaurants, pubs or malls. However, the strictness with which hotels and restaurants opened in India seems to be lost today, as vaccine certificates are the last thing really on their mind.
Crowded markets, busy streets, buzzing restaurants. Delhiites shopping, eating, celebrating. Apart from national and international airports, the hue and cry over vaccine passports has no takers. While countries in Europe and UK are trying to make vaccines mandatory to enjoy visiting restaurants and outdoor spaces, restaurants across Delhi almost never ask visitors if they have been vaccinated or not. We visited a few restaurants in the heart of Delhi. As we walked up the stairs of the first, there was no thermal checking, no sanitizing. When confronted by our camera, the restaurant manager had this to say.
We are checking Arogya Setu and everything that when the guest enters.
But I entered, nobody asked me for my vaccine passport or anything.
Ma'am, I apologize, but I just want to have a word with the ladies because they got scared with the camera. That's the very reason they ran away and they told me, sir.
Camera is scaring everybody.
No, not everybody, the ladies, because they are not like, that's the very reason.
We asked patrons around if they were asked for their vaccine certificates.
People who enter, do they have to show how many vaccine doses they have taken or vaccines?
They never asked me anything of the sort. Why only the restaurants or other things are considering that people are partying and all? What about the rallies? Why don't they stop them?
Similar scenes played out in yet another restaurant. When confronted, the restaurant management reasoned that its staff are vaccinated.
So are you insisting on people having 2 doses of vaccines before they enter?
We are checked, but ma'am, like it's on a weekends, so like it's not possible to check for everyone.
Many restaurants, including posh ones, have abandoned the practice in vogue during the earlier waves, dropping their guards.
कोविड चल रहा है, क्या आप लोगों से वैक्सीन लगाई है नहीं पूछ रहे हैं आने से पहले?
अभी तो नहीं पूछे, लेकिन पहले जरूर पूछते हैं.
Some even say the food and beverage business has suffered the most. Refusing entry to customers on this ground will only hurt more.
But yes, after COVID, people start coming by slowly and gradually. Even, I mean, we are not getting too much of sale, but yes, we need people to come in industry. So this industry can grow again.
Afraid but fatigued during the pandemic and lockdowns, many just want to gather and party.
जाहिर सी बात है, अभी सब कुछ खुल गया है. बहुत टाइम से हम बंद में थे, तो सबका मन होता है लाइक क्रिसमस आ रहा है, न्यू ईयर है, तो सभी पार्टी के मूड में. इनफैक्ट 10th के बोर्ड एग्जाम कंप्लीट में, 12th के बोर्ड एग्जाम कंप्लीट में, सब बच्चों का ऐसा लगता है कि पापा होके आते हैं, चलो. बट स्टिल वी हैव टू बी केयरफुल.
While the government wants caution, crowded markets and restaurants are into anything but muted celebrations.
India seems to have forgotten the rule of checking 2 vaccination doses for people who are fully vaccinated in public places. With Pradeep Gupta in New Delhi, Milan Sharma for India Today.
Well, our next report tells you all about the treatments available now against COVID. Anti-COVID pills are encouraging, but there are questions on their availability and costing.
COVID-19 is showing no signs of disappearing in the near future. Every time one variant plateaus, another emerges. In a world now reconciled to the coronavirus, the search for drugs to battle the newer form of the virus continues. Pharma firms are now finding ways to combat the super mutant variant. Among the top 2 candidates are Molnupiravir from Merck and Paxlovid from Pfizer. Merck claimed in November that relative risk reduction for people who took the Molnupiravir was 30% only, compared to its earlier findings of 50%. Pfizer has recently announced that its experimental COVID-19 pill seems effective against Omicron and claims to reduce combined hospitalization and death by about 89% in high-risk adults. The pills need to be taken shortly after initial COVID-19 symptom. It typically needs to be taken during the onset of the virus for 5 days. The US FDA's panel narrowly recommended Merck's drug for emergency use, with the caveat that it will be revoked if a better drug comes through. Despite Molnupiravir's low efficacy, the UK has approved it. In the United States of America, meanwhile, an independent medical panel reviewed the data and recommended that Pfizer continue the study to get full results before proceeding further with regulators. India's drug regulator has deferred approval of the molnupiravir as clinical trial data from companies remains inconclusive on the drug's efficacy. 6 companies are involved in the making and marketing of the Merck's drug in India.
At this moment, we have found that they have to be given at a very, very, very early stage, even before the diagnosis is coming, and there is not the scientific data is still not supporting in such a big way that that it will be useful at the moment.
Several low and middle income countries are awaiting a decision by the government, as Indian generic firms will be key suppliers of this drug to countries in Southeast Asia and Africa.
Amidst the fact that companies are working on an oral pill to cure COVID-19, the fact remains that the drug should also be safe. And how safe it will be shown by emerging evidence. But how will it be possible to market and give the drug in a country like India is also a big question, so that it's accessible to all. The government at this point is monitoring data on oral pills for COVID-19, which could be game changers if approved. With Hitesh in New Delhi, Milan Sharma for India Today.